Hello everyone, welcome to our YouTube channel, Part 2 Eyes. I hope you all can remember we celebrated World Autism Day a few days back, and today I'm going to talk about one of the subgroups of autism spectrum disorder that is called Asperger syndrome. Autism is a neurodevelopmental disorder. In this condition, we can see three main characteristics, three main impairments, and we call them as triad of impairment. Communication impairment is one of them. Individuals with ASD finding many challenges in conversation. However, children with Asperger syndrome is having very good language skills even though the ability to communicate is affected. Children with Asperger syndrome shows prolonged echolalia, which we call repetitions of word, and they would find many challenges when conversing with others. Children with Asperger syndrome might have enough vocabulary, but they are unable to put these words into sentences to communicate some meaningful words. So most of them would repeat the same question instead of answering the question. Also, they would repeat the same thing again and again instead of creating conversations creatively. In addition, children with Asperger syndrome shows impairments in social integration. Even though they have good language, they might not start up conversation with strangers, and also they would repeat the same question again and again with the strangers. They might not know about the time. For an example, rather matching with the situation, they would initiate conversation saying good morning even in the afternoon or night, because they don't know the difference of the time. And also, these individuals find many challenges when playing with others. They don't like to mix with strangers. They would be very comfortable with whoever the people attached to them, but instead, if they were asked to go out from the box, they would not happy for it. And also, these children with Asperger syndrome shows some inappropriate eye contact with people. They would find it's difficult to maintain the eye contact even though that they can link with other people. Obsessional interest and rigidity in their thoughts is one of another areas that we can identify with children who have Asperger syndrome. They would respond differently for different textures and different lights and different sounds. Thus, they would be hypersensitive or hyposensitive for these sensory stimuli. In addition, children with Asperger syndrome show some resistance to change the usual routine. If there is a time schedule program, they would work according to the time schedule rather changing from it. One of the significant features that we can find with Asperger syndrome is average or above average cognitive skills. We call children with Asperger syndrome are high functioning autistic individuals because of this high level of cognitive skills. These individuals are having super memory power. Thus, most of them are able to recall very tiny memories with small problems. Also, they are very good in maths, and some of them are hyperlexic, which means they can read alphabet, they can read numbers, as well as they can read some words even though they are not taught them. Since the children with Asperger syndrome are showing this average or above average cognitive skills, if you can find out the challenges in your child early as possible, and if you can start the intervention early as possible, that would be helpful for your child to reach to age appropriate very soon. So never hesitate to accept that your child needs some support if you see some of these features in your child. Children with Asperger syndrome can be easily trained by using social stories and visual timetables. Also, since they have very good language skills, with a little help, they will be able to get the communication skills back. Social integration can be taught by mixing them with peers. Occupational therapy and behavioral therapy would be helpful for them to overcome the behavior challenges and to reduce their temper tantrums. Most of the children with Asperger syndrome display the temper tantrums due to the communication inability. Just imagine, you have so many thoughts to say and you don't know how to say it out. And also, information coming from the outside, but you don't know how to perceive them. At such a situation, showing temper tantrums is quite normal. So, improving communication skills would be helpful for your child to reduce these temper tantrums. I know, as parents, we are not ready to accept failures of our children. But delaying to accept these challenges related to Asperger syndrome would make the scenario worse and you will be regret about it in future. Try to get your child assessed and start intervention as early as possible. If you have any questions related to Asperger syndrome or any other topics that we have spoken about these days, you can always comment below and I'm more than happy to help you. Leaving you with a message. Early intervention is very important, not only with ASD, but also with any type of childhood disorder. Stay safe and stay tuned with us. Bye-bye.